Here at Grand River, we're a small hospital, but our emergency room can be extremely busy at times. And a lot of it can be contingent on the weather. There's numerous things that can affect it. But you never know when you come in the emergency room what you're gonna find. So when you do come, some of the things that you can expect is when you come through the door, the most important thing you need to do is talk to a register person who can get you registered and get us notified as medical staff and nurses that we have a patient who needs to be seen.
And in the emergency room, we actually use a process that's called the Triage Process, and it's really about putting resources where they need to be when they need to be there. And so if somebody's really sick and they need a lot of nurse care, physician care, then they're probably going to be seen first and need to be taken care of first before somebody who needs less of those resources. So that's one of the big things that we'd like people to know.
No one ever plans to come to the emergency room, so it helps to be a little bit prepared. And there's things that we can do before things happen, that if something happens and we do need to come to the ER, it makes your ER visit go much smoother and can help your care as you're in the ED also. I had an example yesterday where I had a gentleman who came in with a complaint of a headache and a little dizziness, and he actually looked pretty good, but as we got into the ED visit, I come to find out 3 days ago he had terrible crushing chest pain, and he was really sick, and he didn't realize how sick he was. And he was very ill prepared for his ER visit because, like most of us, we don't think we're going to need to go to the ED. And simple things that you can do to help prepare for an ED visit is to make a complete list, a written list of all medications, their dosages, the frequency in which they're given, and when you normally take them, morning, evening, or night, and a list of all of your allergies to any medication that you might be allergic to, or foods. It's very important we know environmental issues along with medication. And anything you might have taken prior to coming to the ED, if you've taken a bunch of Motrin or you've taken a bunch of Tylenol, which are over-the-counter drugs, we need to know when you last took those dosages. So you might necessarily not have them written down, but your prescription medication, make a list of that, and your allergies. And then another real helpful thing, regardless of your age on these topics, is past medical history. It's amazing how some people will have heart surgery 10 years ago and they don't even think that's important today because they're feeling so fine. They're not having trouble with their heart, they're having trouble with their head. And sometimes these things are interlinked. So these are ways that you can make your ER visit a little bit better and a little bit quicker sometimes also.